I'm going to pull the curtain for privacy. Hi, my name's Josie and I'm going to be your student nurse today. I'm just going to gel my hands real quick and put some gloves on. It looks like from the physician's orders that we need to do a head-to-toe assessment. Is that okay?
Mm-hmm.
All right. And can you please verify your name and date of birth?
Catherine Stanley, 07/18/2002.
And do you have any allergies?
Mm-mm.
Okay, I'm just going to check your wristband and make sure that's all correct. So that all looks to be correct. So first we're just going to start with taking your blood pressure. So we'll have you set your arm right here. And then I'm just going to roll your sleeve up. Yeah, there we go. Okay. And for this, we're going to use the two-step method. Do you want to hypoextend your arm? There. Okay, it was about 112, so we'll bump it up to about 130. Okay, you can relax your arm. I'm just going to grab my stethoscope. Alright, it's going to be a little cold. Alright, I had about 124/68, which is within normal limits, so good. Alright, next I'm just going to get your apical pulse. Is it okay if I go under your shirt?
Yeah.
Okay. I apologize if my hands are cold. Okay, so to do this, we're going to start by finding the angle of Louis. Here and then go over, and that places in the second clavicular space. And we go down to the fifth intercostal space. So that's 3, 4, 5. Then we're gonna move over to the middle, and we should be able to hear it right here. You had 75 beats per minute, which falls within the normal range of 60 to 100 beats, so that's good as well. So next what I'm going to do is we are going to start with, I'm going to assess your scalp for any lumps or bumps or any lesions or anything like that. So we're just gonna feel around, give you a nice little head massage. Alright, so that all checks out. There's no lumps and bumps, no lesions, nothing to worry about there. So that's all good. Next, we're gonna do your hair. I'm just gonna assess the color, blonde, the texture. It's nice and smooth, shiny, very pretty.
Thanks.
You're welcome. And the distribution looks good, so that all looks good. So next, I'm just gonna look at the symmetry of your face, make sure
It's not very symmetrical.
it is very symmetrical, so you're good. Your eyes are even, lips, nose isn't leaning one way or the other. Ears are even as well, so that all looks to check out. So next, I'm just gonna assess your nose. So like I said, your nose isn't leaning one way or the other, so that's good. I'm just gonna check inside your nose real quick. Look at the patency of your nasal cavities. That side looks good, and so does that side. So your nose all checks out. So next, I'm just gonna assess your mouth. So I'm going to have you pull out your bottom lip. I'm just gonna look for any lumps or bumps, which I don't see any there, and then I'm gonna have you do the same with your top lip. And I don't see any lumps or bumps there. Can you open up for me? I'm just gonna look at your teeth and your gums, which your teeth look healthy, nice and white. Your gums are pink. Your tongue is nice and pink as well. And I'm gonna have you say ah, and I'm gonna look at your tonsils and your oral pharynx, and all of that looks good as well. So everything checks out there. So that all looks good. So next, I'm going to assess your skin. Okay. I'm gonna assess your skin. So the color of your skin is good. You still got a tan from summer, so that's nice. I'm gonna just assess the warmth of it, or the temperature of it. Which is warm, you're not too cold, not too hot. I'm just gonna assess your trigger of your skin, the trigger of your skin, to make sure you're not dehydrated, which your skin returns right back to normal. And usually if someone was dehydrated, their skin would stay up a little bit, kind of like a little triangle. So that looks good. Here, your skin checks out. I'm gonna look at your nails, look at the fat around your nails.
Some of them are fake.
It's okay. We got one good one right here. I'm just gonna check your capillary refill. Your nails, when I put pressure on them, they refill within literally less than a second, so that's good. Can I look at your toes?
Yeah.
Okay. Do you want to take off your shoe?
Take off?
Yeah.
Yeah. Both of them?
You can just take off one.
Okay.
I've seen with the capillary refill of your toes as well. So that turn of blood to your toenails is good as well. So all of that looks to check out. Next, I'm just gonna look for.
Can I put my shoe back on?
Yes, you can. Sorry.
No, you're perfectly fine.
Thank you. Is your sock inside out?
No.
Okay.
I don't know, is it?
No, I think you're good.
Okay. You're a great nurse.
Thank you.
Okay.
Alright, next I'm just gonna look at any skin lesions that you have or anything, which I see one here. It's a macule, which is a little freckle right here. So it's flat, not raised at all, so it's good. Next I'm gonna assess for any edema. So I'm just gonna look at your ankles. This is a big one for any edema. And the edema scale works by when you press in, if it goes a millimeter, or if it goes 2 millimeters deep, it's a +1, and it returns right back to normal, like right away. It takes not even, it's immediate. So that would be a +1. Then if it were to go down 4 millimeters, it would be a +2, and that takes a couple of seconds to return back to normal, and then so on and so forth, all the way up to a +4, which is 8 millimeters deep, and it takes like more than 20 seconds to refill, or about 20 seconds to refill. So I don't see any edema with your ankles, or really any edema anywhere else, so that's good. I'm just gonna check your joints, make sure there's no swelling or nothing with any of those. There's no tenderness, so I'm gonna start with your elbows. So I'm gonna have you roll up. Yeah, roll up your sleeves again. So I'm just looking at the joints. There's no warmth. Do you feel any tenderness or anything? Does it hurt at all? Okay. I'm gonna look at this one. Any pain or discomfort? Nope. Okay. You're gonna check your knees. No pain, discomfort, and then your ankles. Feel okay? Okay.
Yeah.
Next, I'm just gonna check your lymph nodes. So we're gonna start with your optical. your optic lymph nodes back here, which feel good. Then we have your post-auricular, which are good. Your pre-auricular, submandibular. I'm sorry, submental. Then we have your superior or your anterior cervical, posterior cervical, and your supraclavicular, which all of those feel good. Nothing was swollen, nothing was inflamed, so you have no infections or anything like that. So that is good. So next we are gonna do. I'm gonna assess your eyes. So I'm gonna ask you a couple questions about your eyes. Do you have? Actually, before we do that, I'm gonna do your range of motions.
Okay.
So I'm going to test out some of your muscles. So first, I'm going to test your sternocleidomastoid muscle in your neck. So I'm going to have you push against my hand to your left. So push against it, okay? And you're right. Okay, good. Next, I'm going to do your trapezius. So I want you to push up, okay? Down, okay. Next, we're going to do your biceps and triceps. We're going to do this side first. You can put that arm down. So for okay, we're gonna do your biceps and triceps. So I want I'm gonna pull your arm towards me, and I want you to keep it going towards you. Okay, like flex it.
Don't let go because I'm gonna hit myself in the face.
I won't. You ready? Okay, and then I'm gonna push on it. Okay, we're gonna do the next one. All right, gonna pull it. Beautiful, and push it. Okay, a little wobbly, but that one was good. Next, I'm gonna do you. Next, I'm gonna do your wrist and your fingers. So can you put your hands up straight like this? And I'm gonna push down, and I want you to push up, and then push down, and then spread your fingers for abduction. And I'm gonna try to bring them together for adduction, and I don't want you to let me do that, okay? Okay, good. Next, we're gonna do, you don't with your hands. Next, we're gonna do your hip abduction and adduction. I had to think of the word. So I want you to separate your legs a little bit. And then I'm going to push your legs together for abduction, and I want you to push against, okay? Ready? All right, now I'm going to do abduction and push away, and I want you to bring them together. Okay. You're good. Next, you're going to do your hamstrings.
Okay.
And your your quads. Hamstrings, quads, and your calves.
Yeah.
Your hamstrings and your calves. There we go. Okay, so I'm going to pull your leg towards me. You keep it back.
Oh.
I'm going to pull it towards me, and I want you to pull back towards you. Okay, ready? Okay, we're gonna test this one. Okay, and then I'm gonna push your cap in, and I want you to go against it, okay? Alright, this one? Okay, next we're gonna do, or lastly, we're gonna do your feet and your toes. So you might have to take your shoes off. Well, no, we're just gonna do your ankles, okay?
Yep.
So it's gonna be the same thing. I'm gonna press down on your toes, and I want you to lift your feet up.
Okay.
Ready? Okay, and then press down on the gas pedal. Perfect. So all of that looked good. It was all equal. One side wasn't weaker than the other, anything like that. So that all looks good. So next I'm going to assess your eyes. So I'm going to ask you a couple questions. Do you have any family history of glaucoma or cataracts? Have you had any eye injuries? Nothing like that. And do you use do you have contacts or glasses?
Yeah.
Okay. So next, I'm just going to look at your pupillary reflexes, make sure that they're equal. So I'm going to shine this into your eye, okay?
Okay.
All right, you ready?
Mhm.
Okay. Your pupils are equal and reactive, so they dilated when I put the light on them, which is what we want them to do. So next, I'm going to have you cover one eye up, doesn't matter which eye, okay? And I just want you to tell me when you see my finger, okay?
Okay, I see it. I see it. I see it.
Okay, we're going to switch into the other eye.
Okay, I see. Okay, I see. Yep, I see.
Okay. Then next, I just want you to follow my finger with your eyes, okay? Don't move your head.
I'm not moving my head.
You did a little bit.
I mean, sorry, ma'am.
Okay, so your eye muscles all look good. One eye wasn't weaker than the other. They all were equal. Your pupils were equal and reactive, so everything looks good there. So next I'm going to assess your ears. So have you had any ear injuries in the past? Do you have you been experiencing any hearing loss? Nothing like that. And did you have a lot of ear infections, or do you get a lot of ear infections? Got the zoomies. Alright, So next, I'm gonna just look at your ears. And I already assessed them earlier. They were they were equal and symmetrical. I can't think of the word. Equal and symmetrical. So next, I'm just gonna look at your auricle. So I'm just gonna pull it back a little bit. Let me know if you have any pain or discomfort.
Okay.
Push your pen on.
Do you like my piercings?
I do.
Thanks.
Mm-hmm.
I got it done at Claire's.
Nice. Now I'm just gonna assess your tympanic membrane. That one looked good. It was gray. Now color next we're gonna go, and I'm gonna do the same thing on this ear. Let me know if there's any pain or tenderness or anything. And then I'm just gonna feel right there. Did you have any pain or discomfort?
No.
And your tympanic membrane looks good in that ear as well. So
Thanks.
you're welcome. So your ear's all checked out. Next, I'm gonna have you just stand up and I'm gonna assess your back for any scoliosis, kyphosis, and lordosis. So scoliosis is curving of your spine. Okay, I need you to bend over.
Okay.
Bend over a little bit. I'm just gonna feel your spine. So
Like all the way?
Nope, you're good. So scoliosis is like curving of your spine, which I'm not feeling that. Kyphosis is outward curving of your spine, so it almost forms like a hump. And then lordosis is inward curving of your spine, which I'm not feeling any of that with that. So you can stand back up. And then I just want you to take a couple of steps, and I'm just going to assess your gait and your balance and make sure you're not leaning to one side or the other. Beautiful. Runway model strut.
Yeah.
So all of that looked good. Next, I'm just going to assess your neuro. I'm going to do a neuro assessment. So throughout the whole assessment, your level of consciousness has been good. You're oriented ×3. You gave me your name, date of birth, and everything. So that's all good. Next, I'm going to assess we just assessed your spine. We assessed all of that. So that all checked out. Then I'm going to have you, I forgot one part of your hearing. I'm gonna have you stand, and I'm gonna whisper something behind your ear, and I just want you to repeat it, okay?
Okay.
Okay, can you stand? Turn around.
Do you want to bend down?
Yeah, a little bit. Okay.
Did I say it back?
Yeah.
We are in Platteville.
Okay, and then I'm gonna do the other ear.
Today is Wednesday.
Perfect. And I also forgot to have you do part of your vision test. So I just want you to read what's on this paper.
Today is Wednesday.
Beautiful.
Thanks.
And your vision's good. So yeah, we did all that. So now I'm gonna do your cranial nerves, okay?
Okay.
So we already did your optic nerve and your abducens when I assessed your eyes and looked at your eye movement. So we're gonna do your olfactory. Okay? So you can't see what this is, close your eyes. Okay. I'm gonna put it right on your nose, and I just want you to take a little smell and tell me what you smell.
Is it cinnamon?
Yes, it is. Beautiful. Stars all around. Yes, you are. Next, I'm going to look at your trigeminal nerve. So what I'm going to do is I'm going to touch a part of your face, and I just want you to tell me what part I'm touching, okay? So close your eyes.
My forehead?
Yeah.
I don't know.
No, that's good.
My nose. My cheek. My other cheek. My chin.
Beautiful. Next, we're going to do your facial nerves, or your facial nerves. So I want you to smile. Can you smile for me? Can you frown?
Frown?
Can you puff your cheeks out? That all looked good too. So next we are going to do, for your glossal and your vagus nerve, I would have had you stick your tongue out, and I would have tested your gag reflex and done like tongue movement in that, which we're not going to do that, so we're not going to worry about that. You're welcome. Next I'm going to do your accessory. So I'm just going to put my hands on your shoulders, and I just want you to do a little shrug. Beautiful. That one was good. That was good.
Thank you.
You're welcome. And lastly, we're going to do your hypoglossal nerve. Got a hair. We're going to do your hypoglossal nerve. So I just want you to stick your tongue out and move side to side. And side to side. Beautiful, beautiful, beautiful. So we did all of that. So that checks out. Your neuro assessment checks out. Everything looked good. Nothing of concern with that. So next I'm going to do your respiratory assessment, okay?
Okay.
So I'm just going to listen to your lungs. And ask you some more questions. Do you have any family history of lung disease or cancer?
Mm-mm.
Do you smoke at all?
Mm-mm.
Have you been experiencing any shortness of breath?
Mm-mm.
Okay, so first, excuse me, I'm just gonna assess your, can you stand for me? I'm just gonna assess your your AP lateral ratio. So that would be that this is equal to half of this.
Okay.
Okay, so sorry, I'm just doing that. Hold on. So your ratio looks good, all that looks good, so you can sit back down. Next. Next, I'm gonna just do.
Keep going.
I'm gonna listen to the back. Actually, could you stand back up again? Sorry
Yeah.
about that. I'm
Oh,
just
it's
gonna listen
okay.
to your back, and I just want you to take a breath. This is gonna be cool again. I'm gonna listen to all the spots on your lungs back here, and I just want you to take a breath or a deep breath with each one. Okay, you ready? So take a deep breath and out. All right. In. Okay, in. Okay, those all sounded good and equal. Your breaths on both sides were equal. Your rhythm was good. All of that was nice. So next, I'm just gonna do the same thing to the front, okay?
Okay.
So I'm gonna turn you to the side so we don't. Okay.
Sorry.
No, it's fine. You can turn to the side. I'm just no.
Oh, like
Face
this?
me.
Oh, sorry.
Yes, it's okay. I'm just gonna do the same thing.
Wait, I
Listen
gotta cough.
to your lungs again up here, okay? So I'm just
Okay.
gonna roll up your shirt just a little bit. There you go.
I'm just.
Ready?
I gotta cough. Okay.
Okay. Your breathing sounded good on that side as well. Nothing of concern to note. Everything sounded equal. So that's good. So next I'm going to do your cardiac assessment. So I'm going to ask you a couple more questions. Do you have any family history of heart attack?
No.
Do you smoke?
No.
And do you have anything in your life that causes like high levels of stress that could, okay. Yeah, that's, we worry about that with stroke and heart attack, but
I don't have coughing so much.
that's okay. So I'm going to listen to your heart now. So now it's right focal pulse. So I'm just going to listen to the different parts of your heart, like your aortic, pulmonic, Erb's point, tricuspid, all of that. So I'm going to have you turn just like a little bit. Yep, just like this.
Give me water. Coughing.
This is aortic, and then you've got pulmonic, Erb's point, and then your tricuspid, mitral. All of that sounded good. Your rate was good and your rhythm. And then with our heart, we hear S1 the loudest at our tricuspid point, and then S2 at the aortic point. So now with that, I'm just going to assess your peripheral pulses, okay? So I'm just going to make sure you got good blood flow. So we're going to start with your temporal right up here.